Hello, guys. I hope so that you will be fine and enjoying good health. Today, I have selected a topic on Salmonella infection. Salmonella infection or Salmonellosis is a common bacterial disease that affects the intestinal tract. Salmonella bacteria typically live in the animal and the human intestines and are shed through stools, feces. Humans become infected most frequently through contaminated water or food. Some people with salmonella infection have no symptoms. Most people develop diarrhea, fever, and stomach abdominal cramps within 8 to 72 hours after exposure. Most healthy people recover within a few days to a week without specific treatment. In some cases, diarrhea can cause severe dehydration and requires prompt medical attention. Life threatening complications also may develop if the infection spreads beyond the intestine. The risk of getting salmonella infection is higher with travel to countries without clean drinking water and proper sewage disposal. As far as symptoms are concerned, salmonella infection is usually caused by eating raw or undercooked meat, poultry, and eggs or eggs products or by drinking unpasteurized milk. The incubation period, the time between exposure and illness, can be 6 hours to 6 days. Often people who have salmonella infection think they have the stomach flu. The possible signs and symptoms of salmonella infection include diarrhea, stomach, abdominal cramps, fever, nausea, vomiting, chills, headache, blood in the stools, fever. And signs and symptoms of salmonella infection generally last a few days to a week. Diarrhea may last up to 10 days, but it may take several months before bowels return to usual stool habits. A few varieties of Salmonella bacteria result in typhoid fever, a sometimes deadly disease that is more common in developing countries. Most people do not need to seek medical attention for Salmonella infection because it clears up on its own within a few days. However, if the affected person is an infant, young child, older adult, or someone with a weakened immune system, call a healthcare provider if illnesses last more than a few days, or is associated with a high grade fever or bloody stools, or it appears to be causing dehydration with signs such as urinating less than usual and dark colored urine or having a dry mouth or tongue. What are the causes? Salmonella bacteria lives in the intestine of people, animal and birds. Most people are infected with salmonella by consuming foods or water that has been contaminated by feces. Infected food and water. Commonly infected food includes raw meat, poultry and seafood. Feces may get onto raw meat and more poultry during the butchering process. Seafoods may be contaminated if harvested from contaminated water. Then the raw or undercooked eggs may be the cause. While an egg shell may seem to be a perfect barrier to contamination, some infected chickens produce eggs that contain salmonella before the shell is even formed. Raw eggs are used in homemade versions of food such as mayonnaise and hollandaise sauce, and unpasteurized dairy products. Unpasteurized milk and milk products, sometimes called raw milk, may be contaminated with salmonella. The pasteurization process kills harmful bacteria, including salmonella. And the fruit and vegetables, some fresh produce, particularly imported varieties, may be irrigated in the field or washed during processing with water contaminated with salmonella. Contamination can also occur in the kitchen when juices from raw meat and poultry come into contact with uncooked foods such as salads. Improperly handled foods. Many foods become contaminated when prepared by people who do not wash their hands thoroughly after using the toilet or changing a diaper or after handling contaminated food. Infected surfaces. Infection can also occur if the people touch something that is contaminated and then put their fingers in their mouths. So it may get into your mouth and into your gut. Infected pets and other animals, especially birds and reptiles, may carry salmonella bacteria on their feathers, fur, or skin, or in their feces. Some pets' foods may be contaminated with salmonella and can infect animals. Risk factors that may increase your risk of salmonella infection include activities that may bring you to closer contact with salmonella bacteria, health problems that may weaken your resistance to infection in general, and increased exposure to international travel. Salmonella infection, including varieties that causes typhoid fever, is more common in developing countries with poor sanitation. Owing, handling, or petting animals, some animals, particularly birds and reptiles, can carry Salmonella bacteria. Salmonella can also be found in animal pens, tanks, cages, and boxes. Stomach and bowel disorders. The body has many natural defenses against salmonella infection. For example, strong stomach acid can kill many types of salmonella bacteria, but some medical problems or medication can short circuit these natural defenses. Examples include antacids. Lowering the stomach's acidity allows more salmonella bacteria to survive. Inflammatory bowel disease. This disorder damages the lining of your intestine, which makes it easier for salmonella bacteria to take hold. And recent use of antibiotic. This can reduce the number of good bacteria in your intestine, which may impair your ability to fight off a salmonella infection. And immune problems. Some medical problems or medications appear to increase your risk of catching salmonella by weakening your immune system. This interferes with your body's ability to fight infections and disease. Examples include HIV/AIDS, sickle cell disease, malaria, anti-rejection drugs taken after organ transplants, and corticosteroids. About the complications, salmonella infection usually is not life-threatening. However, in certain peoples, especially infants and young children, older adults, transplant recipients, pregnant women, and people with weakened immune systems, the development of complications can be dangerous. There might be dehydration. If you can't drink enough to replace the fluid you are losing from diarrhea, you may become dehydrated. Warning signs include urinating less than usual or dark colored urine, dry mouth or tongue, sunken eyes, no tears when crying, and being more tired than usual, fatigue, and irritability or confusion, and bacteremia. If salmonellosis infection enters your bloodstream, bacteremia, it can infect tissues throughout your body, including your urinary system, urinary tract infection, the tissues surrounding the brain and spinal cord, causing meningitis, the lining of the heart or the walls, causing endocarditis, the bones or the bone marrow, causing osteomyelitis, the lining of the blood vessels, especially if you have had a vascular graft such as heart vessels or bypass surgery. Then reactive arthritis. People who have had salmonella are at higher risk of developing reactive arthritis from salmonella infection, also known as Reiter syndromes. Reactive arthritis typically causes eye irritation, painful urination, and painful joints. What is the prevention? The U.S. Department of Agriculture (USDA) oversees and updates inspection, sampling, and testing programs for poultry and meat. The purpose is to cut the number of salmonella infections in the United States. You can avoid getting a salmonella and spreading bacteria to others in several ways, including safely preparing foods, hand washing, avoiding contamination, and not eating raw meat, dairy, or egg products. Preventive methods are especially important when preparing food or providing care for infants, older adults, or people with weakened immune systems. Wash your hands thoroughly can help prevent the transfer of salmonella bacteria to your mouth or to any food you are preparing. Wash your hands with soap and water for 20 seconds after you use the toilet. Change diaper, handle raw meat or poultry, clean up pet feces, and touch pets or other animals and their habitats, especially reptiles or birds. Keep things separate to prevent cross contamination. Store raw meat, poultry, and seafood away from other foods in your refrigerator. If possible, have two cutting boards in your kitchen, one for raw meat and the other for fruits and vegetables. Never place cooked food on an unwashed plate that previously held raw meat. Wash food preparation surfaces thoroughly with soap and water. Avoid eating raw eggs, homemade cookies, dough, ice cream, mayonnaise, hollandaise sauce, and eggnogs all contain raw eggs. If you must consume raw eggs, make sure they have been pasteurized. Cook and store food properly. Be sure to cook food thoroughly and refrigerate or freeze food promptly. As far as diagnosis is concerned, Salmonella infection is usually diagnosed based on sign on symptoms. Salmonella infection can be detected by testing a stool sample. However, most people have recovered from their symptoms by the time the test results returns. If your healthcare provider suspect that you have a salmonella infection in your bloodstream, testing a sample of your blood or the bacteria may be needed and treatment. Most people receive or recover within a few days to a week without specific treatment. Preventing dehydration with adequate fluid intake can help you recover. And treating dehydration, because salmonella infection can cause dehydration, treatment focuses on replacing lost fluids and electrolytes, minerals that balance the amount of water in the body. If dehydration is severe, emergency care room hospitalization may be needed so that fluids can be delivered directly into a vein intravenously. And then the medications are being used. In addition to advising you to drink plenty of fluids, your healthcare provider may recommend antidiarrheals. Medications such as loperamide, Imodium AD can help relieve cramping from diarrhea. However, they may also prolong the diarrhea associated with salmonella infection. Then antibiotic, your healthcare provider may prescribe antibiotic to kill the bacteria. They may are usually given if your provider suspect that salmonella bacteria have entered your bloodstream, your infection is severe, or you have a weakened immune system. Antibiotics are not helpful in most cases of salmonella infection. In fact, antibiotics may extend the period in which you can carry the bacteria and can infect others. They can also increase your risk of getting infected again, relapses. So, what are the lifestyle changes and home remedies? Even if you don't need medical attention for your salmonella infection, you need to take care not to become dehydrated. A common concern with the diarrhea or vomiting, most adults with mild to moderate dehydration from diarrhea, vomiting, or fever can improve their condition by drinking more water or other liquids. Diarrhea may be worsened by full strength fruit juices or soft drinks. For infants and children who have become dehydrated from diarrhea, vomiting, or fever, use oral dehydration solution (ORS) that you can buy without a prescription. These solutions contain water and salt in specific proportions to replenish both fluids and electrolytes. Preparing for your appointment. If you are making appointment with your healthcare provider, here's some information to help you to get ready. If you want to bring a family member or a friend along, if possible, someone who goes with you may remember information you missed or forgot. Find out about any pre-appointment restrictions when you make the appointment. If asked anything you need to do in advance, such as restrict your diet, make a list of your symptoms, including any that may seem unrelated to the reason you schedule the appointment. Make a list of a personal information, including major stresses, recent life changes, or recent travel. Make a list of all medications, vitamins, herbs, or supplements you are taking and the diagnosis. Make a list of questions to ask your healthcare provider. Some basic questions to ask might be include what is likely causing my symptoms other than the most likely cause, what are the possible causes for my symptoms, what tends do I need, what is the best course of action, what are alternatives to the primary approach you are suggesting. If I have other health conditions, how can I best manage them together? Are there any restrictions I need to follow? Should I see a specialist? If medication is prescribed, is there a generic alternative? And what to expect from your doctor, your healthcare provider will need to know about when the illness began, the frequency of the vomiting or diarrhea, whether the vomit or stool contains visible bile, mucus, or blood. If you have a fever, if you have recently traveled outside the country, being prepared to answer the questions, and that will help you to make the most of your appointment time. Salmonella infections are commonly treated with fluoroquinolones or third generation cephalosporins such as ciprofloxacin and ceftriaxone. Enteric or typhoid fever is best treated with antibiotics for 5 to 7 days for uncomplicated cases and up to 10 to 14 days for a severe infection. In addition to advising you to drink plenty of fluids, your healthcare provider may recommend antidiarrheal medications such as loperamide can help relieve cramping from diarrhea, and antibiotics. Your healthcare provider may prescribe antibiotic to kill the bacteria. Due to the emerging resistance to traditional antimicrobial agents such as ampicillin, trimethoprim, sulfamethoxazole, and chlorophenol, azithromycin is increasingly used for the treatment of invasive salmonella infections. Quinolones such as ciprofloxacin are efficiently used in the treatment of systemic salmonellosis due to their bactericidal effect and enhanced activity intracellularly. And ciprofloxacin has become the first line drug for treatment of multi-drug resistant. And because antibiotics do not appear to shorten the duration of symptoms and may actually prolong the duration of convalescent carriage, they are not routinely used to treat uncomplicated non-typhoidal salmonella gastroenteritis. The first line treatment of salmonella infections are fluoroquinolones such as ciprofloxacin and azithromycin. Third generation cephalosporins are also effective, and often they are the first line antibiotic given if the salmonella infection is suspected but not confirmed. Matronidazole treatment does not increase intestinal pathology of the salmonella infected patients. The signs and symptoms of the salmonella infection generally last a few days to a week, and possible signs and symptoms of salmonella infection include diarrhea, stomach, abdominal cramps, fevers, nausea, vomiting, chills, headache, blood in the stool. Cefixime could be considered in acute uncomplicated salmonella enteritis in children with mucoid bloody diarrhea. Extended spectrum cephalosporins, especially ceftriaxones, are commonly used to treat children with invasive infections or severe diarrhea caused by Salmonella enterica. 5 days therapy with ciprofloxacin 10 mg per kg BD starting on day 6 after infection with Salmonella typhimurium significantly reduced the mortality uh, and in the mice, and in CBA mice, ciprofloxacin therapy also resulted in significantly lower viable counts of salmonella. Most people recover from salmonella infection within 4 to 7 days without antibiotics. People who are sick with a salmonella infection should drink extra fluids as long as diarrhea lasts. Antibiotic treatment is recommended for people with severe illness. Chicken is a major source of these illnesses. In fact, about 1 in every 25 packages of chicken at the grocery store are contaminated with salmonella. You can get sick from contaminated chicken if it is not cooked thoroughly. The aminoglycoside antibiotics are not recommended for treating enteric fever due to the infections with Salmonella enterica or typhi. However, based on the in vitro result, therapy with gentamicin and amikacin has been found to be effective against MDR, Salmonella enterica, typhi infections. Yogurt plus human gastric juice greatly depressed the growth rate of the pathogens. After 30 minutes, no more colonies were formed. Even kefir or roti milk plus gastric juice showed inhibition of Salmonella typhimurium after 1 hour. Avoid dairy, alcohol, caffeine, spicy foods, and fried foods that might upset your stomach in the salmonellosis. Consumption constitutes an alternative in the prevention and the treatment of salmonellosis. In vitro and in vivo studies showed the effectiveness of probiotics administration against salmonella infections, such as the use of biflor and flor or such probiotics use. And how can you prevent your salmonellosis? You can prevent it by washing your hands, keep your food preparation areas clean, avoid unpasteurized foods, cook and store your food at the appropriate temperatures, be careful when handling animals, use caution when swimming. Do you suspect that you have a foodborne or waterborne illness? Then you must consult your doctor. And scientists have gathered experimental proof that certain strains of lactobacillus and bifidobacterium can act against salmonellosis. And antibiotics such as ciprofloxacin, azithromycin, and ceftriaxone are sometimes needed to treat patients with severe salmonellosis infections. And antibiotic therapy is the only effective treatment for typhoid. Commonly prescribed antibiotic might include ciprofloxacin, azithromycin, and ceftriaxone. So this was all about the salmonellosis infection. I hope so that you would have enjoyed this video and you would have liked this video. And if you have liked this video, then don't forget to share this video to others, and kindly don't forget to subscribe my channel. And thank you for listening this video, and have a wonderful nice day. Thank you very much.